Good morning, Hawford Health Centre. How can I help?
You haven't told me how much you were drinking. I don't know if you want to.
No, because I'm always embarrassed when you ask me.
OK, well, I won't ask you again.
I was scared. I was scared of going to the gym. Don't know why.
What are you scared about?
I'm fat.
What about smoking?
Yes, I do smoke.
I mean, smoking does make you much, much more likely to get this kind of thing, yeah, unfortunately.
I cannot shift this weight. It's like just eat everything in the fridge. I don't even open the fridge. It's like I shoved the whole fridge in my mouth.
New Year's resolutions can kickstart people in wanting to make some changes with regards to their health.
Perhaps stop smoking, take more exercise, spend more time with their family, do healthy, positive things.
Nicola Davis, please. Hi there, thanks for waiting. Have a seat.
Thank you.
Right, what can I do for you?
I've been swimming a lot. I started swimming three
Great,
times a week
yep.
because I want to try and shift this weight. I am really trying hard now. I sort of swim a good mile at least 3 times a week,
Brilliant.
aqua aerobics. I've got exercises from the physio for walking and that, but I cannot shift this weight. I joined Slimming World and I can stick it for a couple of weeks and then it's like just eat everything in the fridge.
What's your real downside, do you think?
Anything sweet, I will just... Oh, yeah. And it's not... I wouldn't think, oh, yeah, I'll have one of those chocolate bars. I'll have the whole packet and not feel bad about it. I actually feel good when I'm eating it, so this is the problem.
What we should all learn when we've got weight issues is about what we're putting in here, really. And
I know what I'm putting in is wrong.
Yeah, it's about a healthy eating plan. It's not about, oh, you can't have that. It's about, right, let's pick things that you really like and eat them well, and then things that
It is good. I mean, I've done it before and
Yeah.
it's really worked for me, but just this time it's like...
It can work again.
Yeah, OK.
Is there any way the Slimming World people can help you when those attacking the fridge moments come?
I don't even open the fridge. It's like I shoved the whole fridge in my mouth.
Yeah.
And it's almost like I need it. It's not, oh, I really fancy that. I need to eat it.
Right.
And I'm really, really struggling.
I think you're doing everything you can.
I'm trying everything and I'm really exercising, but it's just going on.
So
I've never
exercise
been
by
this big.
itself won't do it. That's what they've guidance has said lately.
Yeah. I'm going back again tonight with my daughter because I was going and then I stopped. I thought I'm just wasting my time.
But it is good going and staying. Do you stay at the group?
Well, my daughter wants to tonight. She's put on a few pounds, so she wants to go and she'll, well, I'll stay with you.
Everybody in these groups are in the same boat, aren't they? And if they're still losing weight, they might have ideas and techniques of what they've done to overcome it.
Yeah, OK.
Yeah?
All right.
All
OK,
right.
then. All right,
No
lovely.
problem. Bye-bye.
Thank you.
Hi there, come and have a seat. Hello, hello, hello.
Hi.
So, Jessica, I'm Dr. Lee. Now, what's the problem?
Hi, Dr. Lee.
Hello.
In school, I could feel this part of my nose really hurting when I touched it. So when I went home, I put something cold on it. And then today, after school, I told my dad to look at it because it hadn't stopped, and he said it was
swollen inside.
Swollen inside. OK. Listen, I'm going to look up your nose. How about that? Now, is it going to hurt if I put this in here, do you think?
If you press it, that's when it hurts.
Okay, so I'll go very gently. Is that all right?
What do you see?
Nothing yet. Is that the bit that hurts?
Yeah. Ow.
Oh. Just wrong leg.
OK. Well, that was a bit painful, huh? Have you or anyone in your family got sores on your mouth called cold sores? Do you have cold sores in the family? Yeah. So occasionally you can get a cold sore up the nose, and it is really painful. Now, that's not a dangerous thing, but what usually happens is it's sore for quite a few days, maybe a week. And then after that, you can get crusting in there that lasts for another 2 weeks, so maybe 3 weeks altogether. I can give you some cream to put in there. Now, listen, put a little bit on the end of your finger and just put it up your nose and rub it round that sore area 5 times a day. And you can do it maybe for 5 days. If it's this, I'm afraid it's still going to be crusty and sore for 3 weeks. We'll see you later in the week. It's a pleasure. Thank you. I'm sorry your dad did that to your nose. I'm very sore.
Thank you.
Bye.
OK, bye-bye.
What do we need to discuss?
I think my ulcer's playing up again.
Just point to where the discomfort is.
It is, like, on my right-hand side, and every time I move, it just feels as if someone's giving me a right wallop in my right-hand side, right on me, like, my kidney side. But I have been under a lot of stress lately.
Was there anything obvious that caused it to come on, other than perhaps the stress?
My partner probably said I was drinking too much.
So, to be clear, was it after you started drinking that this discomfort came on?
Yeah, it came on, like, Sunday. Then Monday I was in discomfort, and then I made a decision not to go work on the Tuesday, and I haven't been in since.
OK. And what have your bowels been like?
Probably gone more than what I usually have gone.
Okay. Loose stools?
Yes.
Stools? Loose stools?
Yeah.
OK. Any blood in the motions or anything like tar in the motions?
No.
And any urinary symptoms at all? Because, as you say, this is a little bit in the kidney area. Have you noticed anything with your urine?
Just going rather a lot.
All right. Should we have a feel of the tongue first?
Yeah.
Yeah, OK. Hop up on the couch.
Yeah.
If you can lie up here. OK, nice half down flat.
See, that hurts doing that, look.
Does it really? Yeah.
Yeah.
So this is where you said you were feeling the pain?
Yeah.
That's sore. We come down here. You're gripping your teeth there, aren't you?
That was hurting there.
Yeah.
Yeah.
What about if I press in here?
That's it.
Interesting.
Come on in, come and take a seat. Yeah, it's not too bad, thanks. How are you? How can I help?
What it is, the bottom of my foot, the heel bit there, is swollen really bad, and I can't walk properly on it.
OK. And whereabouts does it hurt? In the heel?
Like, all in there, up there.
OK. When you wake up in the morning, is the pain OK? No.
It is, well, it's the time it hurts is when I go to sleep, because you're asleep, you don't feel it. And when you wake up, sometimes I'm thinking, cool.
OK, so let's have a look. What might be easier is if you come and have a lie down up here, pop socks and shoes off and just come and have a lie down there.
Salty smell. Cool. Some
No,
part of the reason
don't worry, don't worry about that.
I did have a wash, but some part of the reason my feet keeps on smelling all the time.
That's all right, don't you worry. Got interesting legs, anyway.
Eh?
Interesting legs.
Oh.
So it's the right foot.
Yep.
Do you get pain in here?
Yeah.
It's just in there. So in that point there, when you put pressure on that area, does it hurt when you walk around?
Yeah.
OK. And if I press there, you've got the pain. Sorry. But in the back here...
Sometimes the pain does come up and
it comes up
onto
there.
it as well.
Yeah. Come and take a seat. So 2 things. One is, it sounds a bit like what we call plantar fasciitis.
OK.
OK? Underneath the skin, you've got a kind of fascia, or this kind of membrane type thing, and it can get inflamed. And it feels like someone stuck a pin in your heel. There's certain ways to just help it along. And actually, your feet could do with a little bit of support in the arches because they're slightly flat. Swimming might help. Losing a bit of weight might help.
I was just about to say that.
Yeah. We are doing, in the treatment room...
I'm scared. I'm scared of going to the gym. Don't know why.
What are you scared about?
So fat.
But if you went along to the gym, they can show you exercises that suit you. Because there's people of all shapes and sizes going.
I can't put... Oh, yeah.
Not be worried, because you're only 29, aren't you? So
I don't know why. I should not be scared, really, but I am.
Yeah, no.
My friend goes, he said, mate, there's a bloke that's like 34 stone.
It's quite good to go with a buddy if you've got a friend that wants to do it with you. So go along, give it a go.
OK.
All right.
Brilliant. Thank you.
You're welcome. Take care. Bye.
Bye.
I mean, I think there are several possibilities here, actually. Could this be to do with duodenal ulcer? Yes, it could. But the duodenal ulcer doesn't really explain the flank pain,
Right, okay.
particularly.
Right.
We also worry about inflammation of the pancreas,
Okay.
which is can certainly happen after heavy drinking.
Okay.
Okay. You haven't told me how much you're drinking. I don't know if you want to.
No, because I'm always embarrassed when you ask me.
Okay. Well, I won't ask you again. It's important to be honest with your doctor about how much you're drinking. After all, we are here to help you, but we can only do that if we know what the main issues are. Many people do drink more than is medically sensible, particularly over the festive period. So the new year provides a good opportunity for making changes for the better. So that could be a factor.
Okay.
Okay, so pancreas could be a factor.
Okay.
So we look for that with a blood test. I'd like to get a urine sample done off you now, I think.
Okay.
And then we'll have another chat on the phone this afternoon once we've got results back.
That sounds fine.
Do you think you can go do the pee sample for me now?
I could try.
Go and have a try. OK, there we go. You know there's a loo at the end of the corridor?
I do.
OK. So if you just go up to the end there and then back to room 2.
Yep, OK.
OK?
OK.
Mary Penny? Hello, come on through.
Hiya. Hiya. Thanks for seeing me.
That's quite all right. How can I help today?
This has been on my ear since February, and now it's started to erupt. It's opened. And I'm not sure what it is.
Yeah.
And it's not going away.
How does it feel?
It's quite sore when I lie on it at night, so I don't. It has a sort of burning feel to it, but then that could be because I've now just been touching it.
Any history of skin problems at all?
No, not really. I mean, you know, obviously at my age, all sorts of weird lumps and bumps form, and then they go.
Yeah.
But it's because this is persistent and it's in a sun-exposed area. I just sort of might just let someone look at it.
Yeah, no, absolutely.
It sometimes sort of prickles a bit, almost as though there's a sort of cactus spine in it. It's just a prickle.
It almost has a shiny quality to it, doesn't it?
I don't know, it's quite hard to see.
Yeah, I suppose it's a difficult area for you to see.
Yeah.
OK. Well, it certainly is a sun-exposed area, and I think we take persistent growth like this quite seriously.
OK.
What it looks most like to me is something called a BCC, which is it is a type of skin cancer, but actually, if you're going to get something cancerous, it's probably
on the good list.
On the good side, in that it's slow-growing, never invades other areas, so doesn't spread anywhere.
Yeah.
And so it's something we deal with kind of on a much more routine basis.
Is it treatable?
It's something we would remove.
OK.
If it continues to grow, it can disrupt local structures like the cartilage, etc., in the ears, and become increasingly difficult to cut out. Is there any questions that come from that, or any worries?
No. I mean, it was just a case of I wanted to come in and find out what it was, because the better the devil you know, really.
Yeah. People can sometimes put off coming to see their doctor about lumps or bumps. If you're worried about a lump, particularly if it's growing or changing, I would encourage you to come and see your GP about it. So, what happens next? It is important that you see a specialist. I think that's the first thing to say about definitive treatment, and I suspect that will be cut it out.
OK.
So I'll send a referral letter off.
No, that's great. I'll let you get on with your list. Thanks very much for seeing me as well.
No problem.
So was it painful when you peed then?
No, it's not painful.
I think it's going to be normal. I'll just let that cook for a minute. I'd like to take a blood sample. Can you do that now? Yeah. Well, actually, this is interesting. There is just a tiny trace of blood in the urine. Now, some people do get that for no bad reason.
OK.
But if we don't find anything on the blood tests, maybe we should think about investigating a kidney, which... OK. Most important thing is to check for the pancreas problem we talked about.
OK.
Also check your kidney and liver tests, and I'm checking your blood count as well in case there's any clues on all of that. All right. Great. OK, so that will be back by mid-afternoon. OK, all right, we'll speak later.
OK, thank you,
all right,
Dr. Hill. See you again.
Bye.
All right, cheers.
I've got an appointment at 9:40 today with Dr. Pele.
It's 10:40.
Can I rebook that appointment with him?
Can't wait for it, no.
Well, not an hour.
What you looking for?
It's all right, there's a little problem. I've got it wrong again. It's 10:40. I mean, I'm happy to do 10:40. It just means I've wasted my wife's trip down here and I can come back.
Look, I'm getting rid of him for a day soon.
Yeah.
He's going to his sister.
If he would like to see me at 10:40, I don't believe...
That'll be fine.
Very
All right.
much.
OK, thank you.
So I noticed that last time you came in, you saw Dr. McLaren, and he said he wanted you to have a chest X-ray. Did you ever go for the chest X-ray?
No, I didn't. I was so busy in work, I don't think I did.
So we need to get that chest X-ray. Because you've smoked for a long time, you could potentially have something called COPD, chronic obstructive pulmonary disease, and it's basically where there's damage to your airways, and that can sometimes mean that you get more chest infections regularly.
Oh, I see.
Right, if we can have a listen to your chest. If you pop your jacket off
Of
and
course.
your jumper as well. Right, nice deep breaths for me. And out. OK. So your chest sounds reasonably clear. There's definitely not any wheeze there.
That's good. That's good news.
You've got a few fine crackles, a little bit lower down on both sides, but nothing severe. Have a lean forwards for me. I'm just going to tap on your back.
Okay. You know, I tried to give up smoking last week, and I carried on for 3 days.
Okay.
And when I give up smoking, I become a very quick lose temper. You do not believe. I'm like a Spanish bull, having head down, going... I said to my wife, I'm going back. She said, I know, go back. You did before. You tried to give up before, I know.
So do you want to give up smoking?
I do.
We have specialist nurses that can help you to give up smoking, and all the evidence shows that if you have the help of somebody else, it's a lot more likely to be successful, and that
I think
will
that's the best,
help.
yes.
With regards to your breathing now, I don't think you need any antibiotics, but we need to get you to have this chest X-ray. So I will book you on for the chest X-ray.
Lovely. Thank you for your help.
You're welcome.
Thank you.
Take care. Bye.
Thank you. Bye-bye.
That's yes.
Oh, yeah?
Come and have a seat. OK. So we're having a look at your legs, aren't we, to see what's... So we did a scan to exclude a DVT.
Yeah, but no, I got no pain at all with it, or aching, or burning, or... I went round the garden centres that Saturday, so a lot of traipsing around, and Sunday they seem to have gone
better.
down.
Interesting. Gravity will take fluid down to your feet and into your legs, and activity will bring it back up. I just want to check your blood results, because sometimes, you know, things within that can explain the swelling. So your albumin level, that was the thing I was interested in, and it's a tiny bit low, so it's a sort of protein in the body, and if that drops a little bit, you can get a bit of swelling. It's just under the normal range, so that might account for this swelling in your leg. But as I say, my main concern was if you're getting a blood clot, because with a cancer you're more at risk of blood clots. So having excluded that, I kind of, you know, then I'm not interested anymore. That's not true. Bradley has prostate cancer, which has spread to the bones. It had spread in this manner when it was diagnosed back in 2012. He's been receiving regular treatment from oncology during the past 5 years to prevent further spread of the cancer.
It was just the other night I had a terrible episode where I was so ill, just felt so incredibly ill. But a couple of hours later, I was, you know, all right. Didn't feel sick, didn't have any aches, but just ill. Yeah.
And you're actively having treatment as well at the moment, aren't you? Having the radium...
223,
yes. Is your treatment once a week?
No, once a month.
Once a month, right, OK, so yeah.
So, but they're very good down there. You know, I can't, you know, praise, like, oncology and, well, all you guys enough. Like, everybody's been fantastic. You know, unfortunately...
It's been a bit relentless, hasn't it?
Yeah.
It's one lot of treatment
Well,
and
this is. I think Pam was a bit down the other day because it's hospital appointments, and she said, "Oh, it'd be nice just to have a day off from all this." Yeah. My main concern is, when I lose control of everything. I've accepted. I'm okay with it. I know what's going to happen. But initially, I said, "Oh, I'll just stay home and die at home." But then, seeing how much work was involved with that, so I said, "Well, now I'll go into a hospice." And then, the more you think about it, I probably won't get a choice. I know when I go out that door, I'm not going back.
Yes.
That's the end of the story. But then being carted off somewhere strange, and I think I just want to go to sleep, feel a bit rough one night, go to sleep and not wake up.
Yes.
So, how are things going since we last met up?
Well, I've been doing a headache diary.
Have you noticed anything interesting or enlightening?
Well, mornings it's generally either no headache or like a 2 or something like that, and then it just gradually builds up.
Yeah.
Went to the optometrist.
Yeah.
They said it's got nothing to do with your eyes.
Yeah. Are you still getting headaches all the time?
In the last couple of days, I've been waking up with no headache, which is something different.
Right.
I think this could all just be down to just work.
So, OK, what can you do to counter that then, or balance that out?
One thing I can do is probably take a few more breaks at work, that's for sure. I tend to, a 13-hour day without even quibbling about it and just crack on,
What I see both professionally and personally, with friends and family as well as at work, is that I think people keep going, and then sometimes if you don't do anything, something gives, and you can get something quite serious, I think stress is implicated in a lot of illnesses, and quite serious illnesses, more physical problems as well. So I think it's really important to take note of it. Sometimes we get to a point when it's getting a bit too much, and I do think often that's when our bodies will tell us something, and say, well, hang on a minute, maybe you need to stop and address it and look at it. We know that stress is a big factor in many illnesses, both physical and mental. And we also know that many people are overworking, working harder than they want to, finding it difficult to switch off, and they haven't achieved a good work-life balance. In addition to that, we recognise that at Christmas there are a lot of additional stresses. For example, often being very busy and sociable, spending money that perhaps we don't have. So we recognise it's important after the Christmas and New Year period for us to rest, relax and recoup and perhaps reflect on where we're at and what's a good way to move forward. I appreciate often professionally it's difficult to change things, but I mean, do you think there are things you can change?
I've been having a chat with the bosses, and they're also quite concerned about the whole situation. Got another person on board. We're trying to there's a lot of active stuff that we're doing at work.
And do you think that's going to work?
I think so.
I'm going to book you in to see me in a fortnight.
Yep.
Because I want to see how you're doing from the point of view of the headaches. All right.
Thank you very much.
Thanks, Will. Nice to see you again. Cheers. Bye now.
See you later.
Good luck with it all.
It's hard, isn't it? Because you're kind of you need to be planning in your head that the end is coming one day. But actually, I want you to be living for the moment as well and enjoying what you have left.
But I don't sort of dwell on it. I'm not depressed or anything. Sometimes I'll just sit down and write a letter to Pam or to the grandkids, because that was another thing that sort of scared me, was being so drugged up towards the end. I might not even recognise anybody.
I think we never know. We just don't know what position people are in.
Writing things I want to say.
Yes.
Sometimes when Pam reads them, it upsets her. Then she's all right with it.
Yes.
Yeah.
For patients with cancer, our role is very important. We know the patient, we know their family, and we are often at the centre of the decisions around care. We prescribe with the assistance of the palliative care team, but we're also just there to offer support and talk through any concerns. Some people don't want to talk about the fact that they're dying. Bradley's able to talk about it, and he remains positive, pragmatic and realistic about the future. Have you got a will?
Yeah. That's all that, but mostly, funerals paid for and all stuff like that. All in all, I'm pretty good. I'm, keeping, well, I was going to say well. I'm keeping all right, Right.
Excellent.
Well, nice to see you.
Nice to see you too, and I will see you when you need me.
Yeah. Any problems, I'll
you know where to find me. Yeah.
All right, thank you very much. Oh.
Okay, see you again.
All right, lovely. Thank
Bye-bye.
you very much. Bye-bye.
Proceed. How can I help?
I started to have a bit of a pain in my stomach and a bit of a cough, and I thought it might have been something I'd ate or something. It's kind of been rumbling over the weekend, but it's kind of changed. I've still got this cough, but now I'm getting this pain sort of up here, which radiates like my back.
Okay. How long does it last?
Well, a severe one's probably about like 10 seconds, but this morning it was really bad, and it was happening like every 30 seconds. I'd have this weird wave.
And you're eating okay?
Yeah, eating fine, no sort of loss of appetite or anything like that.
Right, let's check you over and see.
Thank you.
Yep, it's completely fine. Be easier if you came over here.
Yeah.
You okay lying down?
Yeah, of course.
So I'm going to feel all over.
Yeah, that's fine.
And you tell me if I get the place where it hurts. It's definitely not more right or left.
No.
No.
Yeah, it's just there.
There?
Yeah.
Definitely there, right. And we should take a really deep breath. I'm just checking your gallbladder. And then breathe out.
A bit.
That's a bit.
Yeah, just a bit there. And there.
There, definitely.
Yeah.
Come and sit down. Right. Your chest, your lungs and your heart all sound fine. Your blood pressure and temperature are fine.
Yeah.
I think what it is, you're really tender around the top bound of your stomach.
Yeah.
And I think that's probably what's happened, is you've probably got a bit of inflammation inside your stomach.
Okay.
And that's what's causing you all these sudden pains. I think you've got a bit of gastritis. Okay. Have you taken anything for it at all?
I've only been taking sort of Alka-Seltzer, paracetamol, just because that settles my stomach.
That's a good idea. I think what we should do is give you something a bit stronger, something called omeprazole,
Yeah.
which is a tablet to take 1 a day for a month, and normally that gets it better pretty quickly.
Yeah.
The other thing is to alter your diet a little bit. The sort of thing that makes this bad is things like curry, spicy food, very acidic food, and alcohol.
Yeah.
What about smoking?
Yes, I do smoke.
Okay. A lot? Or
No, not really. Probably about 10 to 15 a day.
Yeah, I mean, smoking does make you much more likely to get this kind
Does
of
it?
thing, yeah,
Okay.
unfortunately. Have you thought about trying to stop?
I have tried to give up before.
Yes.
It's just proven difficult, and I've had a vape, and I've tried the patches, but I had a reaction to the patches, so I couldn't try that. The chewing gum was quite good.
I mean, a lot of people have to try quite a lot of times before they get there in the end.
Yeah.
But it doesn't mean to stop trying.
Yeah.
Right, so I've sent that to the chemist.
That's great.
Thanks very much for that. Bye-bye.
Bye.
Okay, come and grab a seat.
Thank you very
Yeah,
much.
hello there. Your mum, aren't you?
I am, yeah.
Drag up.
Thank you.
Okay. Okay, what do we need to talk about?
Oh, God, everything.
What's the most important things we need to talk about?
I've been trying to lose weight, and I've got, like, ME and stuff, so it's obviously difficult. I've been sticking to, like, 1,200 calories a day.
Okay, well done.
And I've also, like, had to go to physio for my shoulder, and there was, like, exercises they gave me to do, which are, like, daily. So I've been doing them, and I've managed to up it a bit and sort of add in, like, a sit-up here and there and some squats, and... But I'm just gaining and gaining weight.
She's just very hard on herself. She works extremely hard and she exercises every day. And before, if I said this time last year, she'd have lost the weight a couple of weeks down to her, not skinny, because you're not a skinny person,
yeah.
but she'd be fit and she'd feel quite able. But she's doing the same things, if not more, and she's not losing anything. And also her moods are awful.
That's
to
fair.
the point that it's like, I'll move out. I'll live with the cat in the little shack at the end of the garden, because it's like it's really like walking on eggshells. Seriously, it's like.
What did you think of that? What Mum just said?
It's fair. I suffer from depression, and as soon as it's like moves, it's like depression will get you back on the tablets. And I don't feel that I'm anywhere near that headspace that I get into when I'm depressed. Like I don't feel. I'm not crying at co-op adverts. That's always the signs. But I am definitely like I'll sit there and then Mum will say something. I'm like like hulking out. And there's no need for me to get angry. But I don't think it's depression.
No, I mean, I must say, I don't get the impression that you're depressed from the way you're talking and from the things that you're saying, actually. So you may sometimes be irritable, but that's not quite the same thing.
Yeah. But I think the weight at the minute is your biggest issue.
You told me that you're being careful with what you eat, you're keeping to a low-calorie diet.
Yeah.
And you've talked about your weight going on.
I was 13 stone last week and I'm up to 13 and a half when I weighed myself yesterday.
In just under a year, you've gone from 78 to 85.
Yeah, it has sort of...
Which obviously is a
ballooned.
significant weight gain. I mean, a couple of things. One is if you can learn to eat slower. A lot of us are wolfers, aren't we?
Yeah.
You know,
I definitely think I'm a wolfer.
You've put in too much before your brain says, hey, I'm full. Make sure you put your hands down between each mouthful. So you take a mouthful,
Yeah.
put your knife and fork down, sit on your hand.
OK.
You finished it. Then take the next mouthful.
Yeah. You're so going to have to get on me about
OK,
doing that.
well, but everyone can do it, can't they? That's a top tip. Another top tip, which I expect you've done already, is to use a smaller plate.
Yeah.
Use a side plate instead of a large plate. Don't come back for seconds.
Once I leave that kitchen, I'm out. No going back.
So is that helpful?
Yeah. Cool.
Okay.
I will start doing that. Thank you very much.
Yeah, let's do it. OK.
Oh.
Sure then. Okay.
Thank you.
Bye-bye.
Bye.
How can I help?
My wife's nagging me about a possible vasectomy.
So what's made you think that would be the right thing to do?
I don't want any more children.
Right.
I'm married. I got 2 children, 2 little
Yes.
boys. Financially, physically, and my wife as well.
That's enough.
We always said we'd have 2.
Yeah.
People question because we've got 2 boys. You know, you might want a girl. It's like, well, yeah, I'm right.
Yeah, fine. And at the moment, what contraception are you using as a couple?
She's having trouble with the pill that she's on, 'cause it's making her quite ill, so
Right.
we're using condoms and stuff as well.
OK.
And she's going to have an injection, I think, in the next couple of weeks, I think,
OK,
potentially. But-
fine. So the situation, interestingly, has changed a bit about referring for a vasectomy now.
OK.
So in the past, until very recently, I would have just referred you for a vasectomy because you want one.
Yep.
But it's changed now that we now need to have tried other methods of contraception, mainly that the women use, obviously, because there are no other methods for men apart from condoms. And they have to have been unsuitable before we are allowed to refer you for a vasectomy.
Right. OK.
And the reason for that is quite sensible, actually. When a woman is using contraception, she also gets some non-contraceptive benefits.
Right.
Like periods can go on the injection, so that's quite nice.
OK.
Or can become less heavy if you're have a particular sort of coil.
Yeah.
Or the pill.
Yeah, because the pill she's on at the moment, she has quite like every couple of weeks, and she's having quite a lot of pain.
So that's
with it,
really
which
not
is why...
working for her.
No, and it's
Yeah.
It's not for a while now. I don't think. Not probably. Since
So
we
I
had
think
our
it's a really good idea for her to try the injection, and
Right.
if that works for her as a method of contraception, then what has been decided in this local area is that that will be the method of contraception rather
Right.
than you have a vasectomy. And the other good reason for that is that having a vasectomy is actually an operation and
Yeah.
has some small risks associated with
Yes,
it.
of course.
And so that are more than your partner having the depot injection. OK?
OK.
So what I suggest is that she has a go at seeing how the injection goes.
Yeah.
If she's unhappy with that as a method of contraception, then she should come back and see her own doctor and talk through other options.
Right.
And then once all the options are tried for the woman, if they fail, then we can refer you for vasectomy. So we have tried to refer a few people who haven't tried the depot injection and haven't tried a coil, and it's been rejected.
Right, OK.
OK?
Okay,
All right,
thank
then.
you very much.
That's OK.
Thank you.
Bye now.
Goodbye.
Barry Thomas, please. Have a seat.
Thank you.
Right, what can I do for you?
What it is, first of all, I got fluid on my leg.
So when you say you've got fluid on your leg, what do you mean exactly?
Well, it's like... See?
Right, OK. So I think what we need to think about is why if they're a bit swollen.
Well, I think it's the, Sorry, I'm out of breath.
Yeah, so take your time.
Yeah.
Catch your breath a second.
Right. I think it's the blood pressure tablets normally do it.
OK. Catch your breath.
Yeah. Because I'm on that.
OK,
Yeah,
calm down.
All right, okay.
I'll have a look at your medication.
Yeah, yeah.
And you take a break. So you've got diabetes, you've got COPD.
Yeah.
Blood pressure.
Yeah.
And was it a heart attack you had in September 2015?
Yeah.
Yeah, OK. And then I'll have a look at your blood pressure. You're on a bit of a cocktail. Right, you've got your breath now.
Yeah, yeah.
OK.
Yeah.
So tell me how long this has been a problem.
Weeks now, probably
Okay.
weeks. If I try to do any walking,
Yeah.
right, okay,
Yeah.
then it swells, swells up
OK.
again.
And is it both legs?
I don't know, no, this one ain't so bad, because I got chicken legs anyway, but, you know what I mean? Sorry.
It's all right. OK. So what about your breathing?
Yeah, my breathing's pretty been, because the thing is, see, I stopped smoking, right?
Well done.
Okay? But I start again, right? I can go 3-4 days cold turkey, not worry about it.
Yeah.
And then, for some reason, my breathing gets better,
Mhm.
right? And I'll smoke again, but I'm still battling it, right? Do you know what I mean?
Keep battling it.
Yeah. Oh, yeah, I got to, because
So
I
when people
feel so
first-
much better when I
Do you?
stop smoking.
Because when people first stop smoking, the tiny little hairs in the airways that have deadened with the cigarettes start to come alive again. And they work and start to bring the muck up again.
Right.
All right? So it can get worse before it gets better. Are you coughing anything up?
Yeah, sort of greeny phlegmish. Yeah.
Any chest pain?
Little bit of discomfort, I guess. Most of the time is when I smoke.
When you smoke?
When I smoke. If I don't smoke,
Right,
I don't
so
get
that's the thing.
I get no pain.
Right.
I don't stress about it. I don't
Okay.
start thinking about dying and all this stuff.
Okay.
I'm like, you know what I mean? It's like
Right, let's have a little look at you. Let's check your blood pressure. So to stop the cigarettes, have you seen our nurses for help?
no. Every time it's like weeks away, innit? And then every time
Yeah, but the thing is-
every time I go there, every time I got to see her,
Yeah.
I've already stopped.
Yeah, but the thing
And
is,
then I don't,
if you do it with their help,
Yeah.
you're more likely to stay off the cigarettes.
Yeah.
All right?
You're right there, yeah, I know that.
So keep your arms straight.
Right.
Okay, bit high. Okay, let me have a little listen to your heart and your chest, okay? Can I pull this up?
Yeah, of course.
Deep breaths. And out. Okay, let's have a look at these legs. Right, if you pull your trousers up. Right, okay. I'm going to give you some antibiotics because you're coughing up green muck.
Yeah.
You're a bit breathless, all right?
Yeah.
I think that's related to the smoking, okay? But I think we need...
both know that,
yeah.
yeah.
But I think we need a bit of an MOT. I think what could be happening, your heart could be struggling a bit to pump all the fluid around, and that's why it's accumulating on the legs, all right?
Okay, yeah.
So I think we need an ECG,
Yeah.
bloods and a chest X-ray to help us work out if there's some signs of heart failure.
I thought you was going to call it ambulance. I thought it was like that, thinking, oh my God.
You're not that bad yet,
Not that
but
bad
let's
yet.
get things better.
All right, cool.
All right?
All right, thank you.
No problem. Nice to see you.
And you.
Bye-bye.
Thank you.
How are things? What are we talking about today?
Good things and new things.
Good.
Things is that I've been able to dramatically change my situation at home, finally.
Excellent. Much better for you.
And then I've started to make goals that are achievable in the short, middle, and long term, which is really good. Actually, I don't think I've ever done that in my whole life. The first one, the now was the house, obviously, to make
Sort
my
all
environment
that out.
livable again. And the middle term is I've had this idea in my head for many years of making a drumming ensemble of many different drumming culture, like world music, all in one
Sounds
place.
fantastic. Yeah.
So that's going to happen, which is amazing. And in the long term, I've already asked for a couple of prospectuses from the Open University because I need some intellectual stimulation so badly.
That's brilliant, George.
Thank you.
And I wish...
I take it as a compliment because it's really been difficult to get to this place.
You said to me last time that you're not going to take the antidepressants and we're going to look into how to manage things. So you've done that for yourself.
Yeah, definitely.
Found out what your needs are and go forward.
And I feel really good, especially mentally. I'm in a really good mental space where I've been eating fish every day. And it's kind of given me some clarity, I think, some sharpness or something.
Your blood tests, kidney function, blood count, liver function, lipids, that they did at the Brecon unit are all fine. So a lot of symptoms have settled down that we talked about last time. We've come a long way, and it's fantastic to see that. So I'll leave that up to you as to when we touch base.
Okay.
So that's a list of things that we've talked about today. But I'm really happy with your short, medium and long-term goals.
Me too.
That's brilliant.
Me too.
Good. Nice to see you, George.
Likewise.
Good. Take care.
Okay, bye-bye.
Bye, George.
Thank you. All right, bye now.
Thank you very much for your time.
Okay, no worries. My New Year's resolution is to address my work-life balance. I'd really like to finish work in time to get home for my son's bedtime.
I've always thought about joining an amateur dramatics society, and next year may be the year that I do that.
Thank you so much.
No problem. Okay, all the best.
My plan for 2018 is to run London Marathon.
That's lovely, Doctor. Super. Thank you very much indeed. Appreciate your time.
In 2018, I plan to spend less time online and more time with my family and doing things outdoors.
Profile Centre can help you. Good morning.
Oh, your lace is undone. Oh dear. Thank you. Go and sit by Mummy then, Billy. Come sit by Mama. Come here, sweetheart. Good boy. Well done. On Mummy's lap, please. I know, sweetheart. All right.
Is he not happy?
No. Basically, he gets impetigo quite a lot. This time round, he woke up screaming and like going, it hurts, it hurts. But I think it's where? I think it's up his nose. He's picking his nose, put it in his mouth, and it's transferring from here to here.
I think what we should do is do a whole lot of swabs to find out if there are viruses there. Because, of course, if there are, I mean, that would explain a number of things. That would explain why he keeps getting it. And it would also tell us a slightly different approach to treating it.
Yeah, this time he's in a lot of more pain with it. Then.
Finley, can you leave that alone, please, sweetie? What else can I find you to play with? Let's...
What's that? It's okay, look. Say thank you. There you go, don't drop it, because it's quite heavy.
Yeah! Ah, fantastic.
Good boy. Mummy, see?
I was going to say, children aren't always very good at knowing whether they've got pain or not. They describe something as pain when it isn't.
Yeah.
So, very healthy. He's doing, actually, what children should be doing, exploring. We just have to make sure he doesn't break anything.
Himself, yeah, because he will jump down from there.
Well, that's all right.
Come here, sweetheart, listen. Oh, you're going to go for a sleep, are you? No, then.
There's a...
Look, you're making a mess.
And we'll also take a swab from his nose to see if he's got stuff in his nose.
Yeah.
Because that might be relevant.
Yeah, and he doesn't stop picking it.
No.
Stop picking.
I don't... I think this is a normal child. I think he's doing all sorts of normal child things.
Are you?
Which include picking his...
Oh, and eating it. That's gross. Booger bogey pie.
Go and get the stuff. I won't be a moment.
Okay. Let me see in your ears. Ready? Finley? Mummy, have a look. He's taking your job, I'm
Very
afraid.
good. Very good. Finley, just put your head
Good
back.
boy, that's it. Good boy. Tickle, tickle.
That's
it's okay. Good boy.
Very
Well
good.
done. Finners.
The other one, he needs to sit on your lap.
Finley,
this will hurt a little bit, so keep very still.
Okay, it's okay.
Finished.
Well done. Well done. Good boy. High five. You did brilliantly. You did great. There.
Who's the doctor?
Dr. Cordelia. Yeah.
Hello. Just hold it for 10 seconds. So yes, when the results come back, give him a ring and see what he wants to do about it.
All right, okay.
All right. Bye-bye. Yeah, okay.
Hazel Sarrow, please. I'll see
seat.
Right, thank you. Okay. Oh, nice and cool in here.
The windows are open, I know. Yeah.
It's like me, I got my whole house open.
Right, what can I do for you?
I have 2 fingers that keep locking up.
Okay.
Which I thought would go, but my little finger is now following that finger.
Right, so it's your little finger and your ring finger.
Yeah.
And how long has that been for?
It's been, I'd say, for about a good 5-6 weeks. But I thought, you know, like sometimes you think you've pulled something and it'll go.
Yeah. So they're locking shut. Yeah.
They're like actually down like that, and to get them to go up with the rest of them, they kind of follow along, but like within a clicking movement.
Yeah. And how painful is that then?
Doesn't hurt.
Doesn't hurt.
It's just weird.
Okay.
It probably follows along with the rest of me.
So, okay, let's have a little look at your fingers. So, at rest, doing nothing, not painful? No. Looks okay.
I've not noticed any swelling
No
or...
swelling?
Yeah.
No. So there's no funny nodules or anything?
Not that I noticed.
No. Good.
In my pudgy hands.
They're not pudgy. Okay, I mean, it sounds like sort of trigger finger.
Oh, don't tempt me. I've got a lot of people I could shoot at.
Let's have a look. Right, so, yep, that makes a good diagnosis, isn't it? A trigger finger is a finger that becomes locked after it has been bent, flexed. That's exactly what it is, isn't it?
Yeah.
And 1 in 5 people will improve without any treatment.
There you go then.
Okay.
Yeah.
Now, if it's not bothering you, I think that's our biggest option, isn't it? Sometimes then, if it's not helping, you can use a splint, a steroid injection into the tendon sheath.
That sounds lovely.
Yeah, it doesn't, does it really? So let's do the nothing.
Yeah, I
Fine.
didn't expect there to be a quick and easy answer.
There we go. This is about your fingers.
Your wonky fingers.
Yeah.
Yeah, lovely job.
Nice
Thank you
to
very
see you.
much. Thanks,
Bye-bye.
lovely. Bye.
Come on in, have a seat.
You right there, love, yeah?
Yep. OK, so I've got a letter from the probation service.
Well, I got released, obviously, yesterday from Guy's Marsh prison.
OK, yep.
So they would, obviously, what it was, I wanted to get things in motion. I wanted to plan things to make sure, because last time I got out of jail, I ended up getting back on it. So this time I put a few things in place to make sure everything was right. I ain't gonna lie to you, my chest is bunged up, you know, and I started smoking again, like
Right.
a bit of twat, really.
So you're
but-
allowed to smoke in jail again?
No, you're not allowed to.
As soon as you came out?
Yeah,
Right.
you know what I mean? Where I'm not used to it, it's
OK.
killing my chest off.
That's fine.
This is what I wanted to show you.
Oh, yeah. OK. So what's that from?
Burns
From what?
from being picked on in jail.
Really?
Yeah.
With cigarette butts or?
Yeah.
Right. Oh, dear. I think they're infected.
Yeah, that's
OK?
what I thought.
So we'll try a course of antibiotic for that, OK? So that's another thing. Yep. So there's quite a few things. Take a seat again.
I need to also see something about my mental health.
Yeah.
My head seems to be going on me. 1 minute I'm all right, next minute I'm stressed out. I actually feel like suicidal.
There's 1, 2, 3, 4, 5, 6, 7 things that I'm going to try and do in 10 minutes, which is going to be quite tough, all right? So I think we get the things that we've got to get done today.
Important things, yeah.
And then we'll
that's
move
fine.
on, OK? Is the probation officer that you've got helping you
Yeah,
with things like housing and...
Yeah.
Yes.
Also asked her to try and get me out, because obviously I was doing a bit of reading in there. I was getting
Yeah.
pretty good at it as well, so I want to continue that.
OK. And at the moment, you are not taking any opiates, any
No.
heroin or
No.
substitutes. OK, so that's that form done. OK. And your certificate will have drug addiction therapy as the reason why you're not working, yes?
Yeah.
Right, and have you used at all since you've been
No, I
out?
ain't used nothing.
So I'm going to do the scripts now for 16 milligrams of the Subutex on a blue script. Yep. So in prison, you were essentially bullied. Yeah.
Pretty much.
Did you? And you didn't feel safe?
Nah, I felt safe, but just, you know what I mean? Yeah, I wouldn't say bullied. I wouldn't go that far.
Wouldn't you? Well, those attacks on your body.
Yeah. Childish, innit?
Yes, exactly. Yeah.
Yeah, believe it or not, there's a lot to take in when you're this side of the wall, believe it or not. Still,
it's very different.
Still soaking it in at the moment, yeah. It's a lot more stressful out here than it is in there.
OK, so let's do your chest next. So you've got asthma.
No, I ain't had it for years. Well, I have, but it comes and goes sort of thing.
Yeah.
Because I just got out from non-smoking
Yeah.
to getting a little bit carried away, if you know what I mean.
Do you think you'll be able to do anything about smoking?
Well, give that, you mean?
Yeah.
Oh, I don't know about that.
So let's have a listen in and check you haven't got an infection or something. That's clear at the front. You're a little bit wheezy at the back. Definitely. So you didn't have any problems whilst you were in prison?
No.
I'm just thinking that if I give you some inhalers, I'm not sure how useful they're going to be if you're smoking quite a lot. You know what I mean?
You just cut down.
Yeah.
Well aware of that.
Yeah. Do you want to just try that for the next 10 days, and then when you see Dr. Clark, you can review it again?
Yeah.
So for skin things, we normally give flucloxacillin 4 times a day for 5 days. Yeah?
Yeah, that's fine.
So that's another script for you to take round. OK, so how are we doing? So we've done the amitriptyline, we've done the Subutex, we've done the form for Rhodes, we've listened to your chest, we've done a certificate, we've done the skin. So the only thing we haven't done, which I think really needs a bit longer than we've got, is to think again about how your mood is.
Well, you want a deadline, are you?
Well, we get 10 minutes for each patient.
Oh, right.
Yeah? That's what we're booked. And it's difficult to manage this many problems in 10 minutes,
Yeah,
but
of course.
I'm giving you a bit more time and not helping the others out with the other patients
Yeah,
at the
I appreciate
moment.
it.
Is that
It's just
all right?
like, if I don't cover all the angles,
Yeah.
you know what I mean, it gets
Yes.
too much for
Yeah.
me to deal with.
So what I want to do is get you an appointment to see Dr. Clark before this script runs out, and you really must attend it,
Yeah, don't
OK?
worry, I will be.
And what I'll do is I'll give you 20 minutes with her.
Everything, yeah?
That is everything apart from reviewing your mood, which I think needs more time.
Yeah, definitely.
Yeah? OK, George.
Definitely. Appreciate that. Thank you.
That's OK.
Have a nice day.
Bye now.
Bye.
What's your date of birth?
8240. Hello, you're not here as well, eh? Oh, my door. Everybody's falling apart.
Hi.
Hiya.
How are you doing?
I've had a really funny tummy
right.
since last Monday. And really painful. And I thought, OK. And then after that, I sort of felt a bit dizzy, fevery. So I went to bed early. But the next day, the diarrhea came, and that wasn't very pleasant.
I
And
see,
that's
so that-
been going on since really.
So
And,
basically, it's been exactly a week now, then.
every time I ate something, you know, 5-10 minutes later, I was in the loo. The worrying thing last night was I sort of woke up and just had a glass of water at about 3. Got the griping pains, but also these awful pains down my leg again.
All right. You said that things seem to have settled a little bit
Yes,
over the day to
yeah,
day. Is
they
that
have,
compared with all week, or is that just
Yes.
compared with last night?
Compared with all week, really.
And no blood anywhere?
No, thank goodness.
Are you working at the moment?
I work in primary school.
OK. What do you do there?
I'm a teaching assistant,
Yeah.
but you can't rush off and go to the loo for 10 minutes
No,
in
well,
the school,
also,
can
if
you?
it is a bug, which it does
Yeah.
sound very likely, you wouldn't want to be spreading it around the school too. So, 162.99, which is a little bit high. Sometimes, if you're a bit unwell, it can push it up, and you know, sometimes just coming to the doctor can make it high. So I'm not going to get too worried about a single high blood pressure reading when you're not very well. You said nobody else has been unwell. Have you eaten anything funny?
No, the only thing I could think of, you know those baguettes you can get, those part-baked things? I'd done those on the Sunday, but everybody had eaten a bit of that.
Okay.
But the following day I had a bit with some cheese, and my husband picked them up later, and you know how sometimes the bread bag can smell of acetone?
Uh-huh.
He said to me, I thought, oh, no, I've eaten a bit of those. That's the only thing that was different to anybody
But as you
else.
say, everybody else had them, so it'd be
They had
unusual.
them, you know, on the Sunday.
Hop up on the couch, let me have a feel of your tummy.
OK.
There you go, rest yourself back. Can I just have a look
Yes,
here?
of course, probably I'm a bit warm.
That's all right. How many times a day are you going when you get the diarrhoea?
Sort of like every couple of hours, but I'm not wanting to eat much. So,
No.
But it's always after I've eaten something, about 20 minutes or so.
Yeah. Any pains in the legs now?
Nothing.
No.
Just the pressing pain. That you're
Sure, well, jump up and come and have a seat. It is likely that this is just a tummy bug. Where you've got it from is sometimes difficult for us to say. And it's true that you wouldn't usually expect to get leg pains as one of the things that you get with classic tummy bugs.
That's right.
Sometimes you might get some leg pains if you've got a temperature or an illness. It can make you have aches and pains all over in the muscles, or it may be that you've just lost some of the minerals in the diarrhoea, and that's got you a little bit deficient in some of those that might give you some cramping. So there are a couple of explanations that I'd be happy with. But I think the main thing is, actually, they seem to have settled down and the diarrhoea seems to be settling, and actually your tummy is soft and there's no tenderness there now. So I'm not going to overreact. I do think you need a few more days off until it's all definitely gone away. And it's definitely true that I would like to see a poo sample, because it has been going on a week, just to make sure that there's no infection there that we should be treating.
OK. So do I get that from the treatment room?
From the treatment room. Sorry, I've run out of them from here, so you'll have to go and
Thank
collect
you.
that.
Nice to see you.
Nice to see you, and I hope it settles down in the next few days.
And me. Thank you so much.
Bye then.
Bye-bye.
$11:30, 12 o'clock, 12:30, 1 o'clock, 1:30, or 2 o'clock. Or I got Monday evening.
Right, what do we need to discuss?
You've had pains in your ankle, haven't you, for a while?
Pains in the...
In her ankle, and then it's all swollen up. She's been down twice before because it's swollen. They gave her antibiotics, but it hasn't gone down. She'd come back again because her leg was swollen, like the top of her leg was swollen.
3 inches bigger than this.
But the last couple of days, she's suddenly been getting pains in her head, like headache pains, and saying that her face and things ache.
And now here hurts, and in the car, my jaws started hurting, and it's inside.
But she's got a hospital appointment to come for Tuesday, but I didn't want to leave it sort of the weekend.
Do you mind if you just have a look and see what the last doctor wrote about you? You had a sore wrist as well, is that
Yeah.
right? You still got a sore wrist?
Yeah, it hurts when I do that.
She wondered whether you might have what's called inflammatory arthritis, which is something that can be triggered off by infections in children.
Felicity's case is not clear-cut, but she had several features such as swelling and tenderness of joints, which suggested inflammatory arthritis. There are several different types of inflammatory arthritis, and it can affect all age groups, including children, very often triggered by an infection.
So the first things you saw were these spots?
Yeah.
And are they starting to improve?
Yeah.
OK, so whereabouts in your head and your jaw is it hurting at the moment?
Here and up here.
OK, do you think her face is swollen at all, Mum?
Yeah, my mum said this morning about her face looked a bit swollen.
So is that pressed around here? Is that sore at all?
No.
Particularly over there? No? Press around here, is it sore at all?
No.
No. Look up for me. It's pretty normal. Whereabouts in your head is it uncomfortable?
Like, it hurts just like when there's any loud noises, especially when there's loud noises, it makes all over my head hurt.
OK, is it hurting at the moment, your head?
No.
No. So I can't find a specific cause for this headache, which I can put my finger on.
Yeah.
OK, what we've got is lots of little things, and I suspect they are going to add up to something, but I'm not sure what that something is yet.
Yeah, OK.
I think you're probably going to have to wait till next week when you see the kids' clinic and probably have some blood tests done and see what they make of it. OK?
Yeah, that's right.
OK. Well, I think you've been very brave and very grown up with all this, and you'll have an exciting trip to hospital next week to see what they make of it all.
Get the day off of school, don't you?
All right. So you happy with that?
Yeah, OK, so, all right, thank you.
Okay.
All right. Bye-bye.
Thanks, bye. All right.
Yeah.
You're coming because I phoned you last night, didn't
Yeah.
I? Yeah. That's great. Thanks for coming. And don't be alarmed. The reason you look worried.
Oh, well, yeah. Well, I am a little bit worried. Also,
Yeah.
I'm not very well. Yeah.
OK. Shall I start with why I phoned you? So you had your smear taken, and because on that we had described you as having bleeding after sex, the report came back saying the smear results were absolutely fine and normal.
Oh, right, OK.
But this bleeding is going on.
That's what I want to talk about.
Okay.
Right, so I'm on my period now. It's the first period I've had for 3 months.
Okay.
Yesterday, I was in chronic pain, and when I say chronic pain, it was definitely at least a 9 out of 10.
Okay.
I couldn't speak because I was in so much pain.
Okay.
It was unbearable, just like... I'm really feeling sick with it every time as well, like I'm going to throw up. I'm getting really, really painful periods anyway.
Okay.
I'm getting pain after sex. I'm sometimes bleeding after sex.
Yeah.
So all these things are happening.
Can I just ask a couple of other questions, just to clarify in my head? Are you on any contraception of any sort? No. Okay. Are you trying to get pregnant?
No, we're not
Okay, so-
trying.
yeah.
I'm going perimenopausal for the last 2 or 3 years anyway, with hot flushes and all the rest of it, and then
Yeah.
my periods are becoming more scant.
Yeah.
And when the pain happens, it feels like it's in my bowel. And each time it's been really severe, it's been that same sensation.
Okay.
It's completely abnormal.
Yes.
You know, I want thorough investigations done.
I agree.
Because
Yeah,
they've done these, you know, the ultrasound and everything, and I can feel it in my bowels.
Yeah.
The pain is so severe that I knew that there's something wrong.
Yori McRae. So if you come round and have a seat, and your mum, yes?
Maxine, yeah.
Maxine. So I'm Dr. Graham. How can I help?
Yuri has been doing a regular checkup on his health about overweight.
Yes.
He went to see the consultant in children's.
Yes.
And I received a letter that he need to sign up on the program for Slimming World.
Right.
Where he, I think they sent a letter about him getting some vouchers.
Yes. And he's still being seen by the clinic at the hospital?
Yes, he have an appointment coming up in November.
OK, so the plan is that he goes to Slimming World or Weight Watchers before then? Yeah?
Yes.
And then they see how that goes?
Oh, yes, because he's overweight for his age.
Yeah. OK, that's great. So we need to fill in the form for the Slimming World and Weight Watchers scheme. Let me explain to Fiona how that works, OK?
OK.
So if you go into there, OK, so it's Live Well Bristol is the organisation that's running this service. So what we do is we fill in the form and you sign to say that you give permission to be rung by this organisation. And then they ring you and they tell you which services are available near to where you live. This is usually for grown-ups. You are quite grown-up, so I think it's reasonable to go to a grown-up one. How do you feel about that? You're all right with that? I think that's what's important, to be honest. Is it something you want to do? Because you need to do it, don't you? You need to want to do it yourself, yeah? Do you see what I mean?
Yeah.
And you'd be going too?
Maybe.
No, accompanying him.
Yeah.
Is what I meant,
Yeah.
really. Yeah. So I will put that through.
Yeah.
But I want to tell you what the children option is.
Yeah.
Yeah. So the children's option is something called Alive and Kicking.
He has been through that several times and it doesn't...
Fine. That's helpful. I'll put that down here. This is about re-educating normal eating patterns. Are you feeling reasonably positive about it? Yeah? Good. OK.
So do I take this or I leave this
No,
with you?
we process that.
Oh, you process it and
Yeah.
OK. Thank you very much.
That's all right. OK.
Thanks a lot,
Bye
Dr.
now.
Graham. Bye.
I agree, it's time for us to ask gynecology to see you.
Yeah, definitely.
It is worth just checking your ovarian hormones to see where you are in relation to menopause. So if we'll arrange for a blood test, I'll request a scan, I'll write a letter to gynecology asking them to see you.
OK. So there'll be specialists in Andrew.
They'll be specialists in that, gynecologists deal with everything.
With all of that.
All women's health, kind of.
OK. Brilliant.
Can I put a hand on your tummy? But I don't think I need to do an internal examination in that you've had all these scans that are doing that.
So you just need to...
Just want to... Yeah, if I can just get you to come and lie yourself on here. And you're still feeling pretty
tender.
Yeah. Yes, you look like you're kind of moving gingerly. I'll start on the right side just so... Even that's a bit sore. Yeah.
It's
Okay.
really tender, actually.
And that is sore over there if I press a little bit harder.
Yeah, that hurts.
Yeah. Okay. Fine. come and sit yourself up again. I'm not going to do any more than that today. And you say that someone has looked at your cervix.
Yeah, they
just want to make sure that that's...
They put a camera inside me when they did the ultrasound as well. They did an internal.
But that's an internal scan rather than having...
I thought they were checking the cervix as well.
They don't look at it. I want someone to visually see.
Okay.
Okay, so leave that with me.
Brilliant.
Just take that to the desk. They'll sort you out the blood test.
Excellent.
Okay. But if you're in trouble, just give us a ring.
Okay.
And I'll get back to you.
All right then. Thank you.
Get you back in. All right.
Bye.
Let's go. Hi.
Hiya.
Let's go. Follow the
You
doctor.
Zachary?
Yeah, he's Zachary.
Yeah, come along, Zachary.
Okay, follow the doctor in. Joshua and
Benji
Benji's
chairs for your clan.
Don't worry, no, they can just sit on the floor.
Mum, come and sit here, and we'll find another chair for you, Zachary.
Zach can sit on my knee. It's fine.
Okay.
No problem. Come here, Puppet.
All right, an eye problem, obviously.
Yes,
Yeah,
really
talk me through it.
Just, I mean, he says it was hurting yesterday, but I've only noticed it today. And he just can't open it, and he's rubbing it, and I've tried to have a look, and I can't see anything in it, but I just wanted to... He's really crying in pain. At times, it seems kind of on and off.
Did it come on gradually or suddenly?
Suddenly, I think. Did it come on suddenly? But it's just the opening. He's doing this all afternoon.
Yeah, okay. Can he see through that eye? Obviously, it's uncomfortable for him, but if he opens it...
At times, he's been okay.
Yeah.
And he's... Yeah, you can see through it, can't you? It's difficult to tell whether anything's blurry or anything.
Okay.
So, sorry, that's not very helpful.
Okay. And has he had any discharge from it?
No, nothing at all. It looks very bloodshot, but...
It does look very bloodshot.
I think that might just be the rubbing.
Do you think he's managed to rub anything into it?
Well, I mean, it's not like he's been playing in the mud today or anything.
Okay, look to your right, would you? Okay, now we're going to look in this one. It's interesting, Mum. If you look in this eye, even this one's a bit bloodshot.
He's not been rubbing that one at all.
No.
That one's been the good one.
All right, now I just want to check that you can see all right. Okay? You're going to have to open your eyes for this. How's your reading, Zach? Are you good at reading?
He's very good at reading.
Yeah? So if I give you something to read, you don't really need to manage the words, you just need to tell me what the letters are. Okay? Let's cover that eye, and you can just tell me what the letters are at the top. All the words, if you want. A P, then what?
Le.
Fantastic. And now let's try it with this eye. Open it up. Fantastic. So your reading's all right. My guess is he's actually got a viral conjunctivitis. That's what it looks like. So quite watery, uncomfortable, red both sides. Bit worse on the right, and he's compounded it by rubbing, and maybe he's scratched the surface or something like that. And I suggest what we do is give some soothing drops overnight. Okay. These are technically antibiotic drops. The point of using them is that if he has scratched the surface, then they will just help it.
Stop. Okay, great, thank you very much.
All right.
Okay, we're going to get some nice drops in.
You were terribly good today, actually. Fantastic.
You were really
good work.
brave. Good job. A little bit of medicine in your eye is going to help it feel better. Okay?
Okay, well done. Well done.
Okay, are you okay? If you walk, I'm going to take the prescription. Thank you very much.
Do try not to rub them, okay? Because when you rub a bad eye, it sometimes makes it worse.
So viral conjunctivitis isn't going to be infectious, is it? Or is it?
Be.
Everything else. We'll keep wash hands, okay. Great.
I'm going to wash mine now.
Okay, good. Yeah. Okay, out the door, say thank you very much. And
well
bye-bye.
done, guys. Bye-bye.
Bye-bye. Thank you. Thanks
Okay,
a lot.
bye-bye.
Which way do we go?
You go left.
Oh, left. Perfect. Right.
It came from my stomach because I did another poo sample last week.
I saw that.
Yeah.
Yes.
And that's come back the same.
Yes.
I'm still getting the same problems. I'm doing the FOD diet now.
Okay.
And
how's that?
It's going okay. So I'm trying to stick to it as best I can. I'm still getting the very loose diarrhea in the mornings and the cramp. It's when I'm in the toilet and I'm having this, like, I go so hot and clammy and sweaty.
Right.
Like, I need to have the door open.
And how often does this happen?
It's every morning. It's in the morning as well, it happens.
Is it always once a day, or is it more often?
Well, I only do it once a day.
It's once a day?
Yeah.
It's once a day, and then...
I
and
have
it's always
very
in the
bad
morning.
bottom wind all day.
Oh dear, right.
Constantly. And it's quite, I mean, it can be quite embarrassing because it's quite bad.
Yeah. And when did you start this FODMAP diet?
About a month ago now.
And are you managing to stick to it? Because I know it's not that easy, is it?
No, I am. Yeah. Apart from pork pies, I kind of got a thing for pork pies. I'm trying to cut back on them.
Okay.
So, because I think they're probably... And also, Coke, cans of Coke, I've cut down a lot on that because I know that's not good either.
That's not good, no.
No,
really
and...
good. And how much Coke do you have a day?
Probably about 1 to 2 cans now.
And what were you having?
Probably about 4 or 5 cans. So yeah, it's not.
Is that Diet Coke or is that ordinary?
Ordinary. It's
Ordinary Coke.
Yeah. So,
Okay.
Which I know is.
I think that's probably quite a lot of the problem. Isn't
Yeah.
it? Yeah, because I mean,
So-
fizzy drinks are really bad. For
Really
you.
bad.
Really
yeah.
bad for you, and all that sugar content as well.
Yeah.
Let me just look at the tests for your
Yeah.
bowels. Okay, and we've done all the blood tests, haven't we, to rule
Yeah.
out anything serious?
Yeah.
And celiac screen and everything. You know, we have investigated this one, and I think almost certainly this is diet related.
Yeah.
I think it's really the pork pies and the Coke, isn't it?
Yeah.
I know it's not easy when you
No.
really like them, is it?
No, but it's, it's going to help my stomach.
I think so. I think so. I think if you can do that, it will gradually get better.
Yeah, definitely. Yeah.
Okay.
All right.
All right.
Thank you.
Okay. Bye.
Bye.
Take a seat, Craig. So thanks for coming in. So I just wanted to check your height and weight and see how you're getting on with your tablets. So how are you getting on?
They're getting on all right, to be fair.
Mm-hmm.
They're improving with the sleep.
Mm-hmm.
Because I think it's getting easier for me to cope with them.
OK. What do you mean easier to cope with them? What was
Because I know roughly when they're going to wear out if I take it at a certain time.
Uh-huh.
So I take it now as soon as I wake up.
OK.
And then it wears out usually around about when I go to bed.
OK. So, and do you feel a lot calmer on them?
Most days, yeah.
OK. Craig is taking methylphenidate, which is one of the treatment options for ADHD, or attention deficit hyperactivity disorder. Another name that methylphenidate is commonly known by is Ritalin. Craig was diagnosed with ADHD in early childhood, and initial therapy is started by a specialist in this area. And we have a shared care program by which we also monitor the methylphenidate. We have to monitor growth in children, and that's why I was checking his height and weight. It can also lead to an increase in blood pressure, which is why we keep an eye on blood pressure. You last had some kind of seizure, or
Yeah.
that was about a year ago, and you went to A&E. You'd never had one before.
Yeah.
What was that all about?
I was outside in my garden playing with my little brother, and he went in for 5 minutes to get a drink, go to the toilet. And I was leaning on my goalpost, and I said to my dad that I feel dizzy. And the last thing I remember him saying to me was, sit down. And he described it to me as that I literally just collapsed.
And you've not had any problems since that? So for
No.
a year, you haven't had any of this query seizure, we should call it, really.
But I have been getting dizziness since then.
Has that been long-term since then?
Happened about 3 times a week since it happened.
OK, how can I help?
I had some bloods done last Friday.
OK.
Just because I've had some symptoms of a urine infection.
There was some mention of an infection around the feeding
Yeah.
tube. Is that the other thing?
Yep. The other day it got pulled by accident and it's just been a bit weepy and...
Let's have a quick look. What's the best way of looking?
Lift him dress up, I guess.
Yeah. Is that all right?
But yeah, no, that's fine. Yeah.
Okay, great.
It's not taped the best, but yeah, it just got a bit
Yes,
yanked the other day.
it is a
I've been
bit.
cleaning it.
Natalie has a feeding tube because her stomach doesn't empty properly. So she has a tube put in beyond her stomach in the small bowel. A bit weepy, and it's a little bit red.
Yeah.
A bit inflamed. Yeah.
Yeah, and it's not usually
Okay.
like that.
So, and the fusidic acid normally does the trick, does it?
Yeah, it usually does.
I think because it's weepy, it's worth giving you some of that, okay? And then if it's only inflamed, sometimes we just give some steroid cream for it. So hopefully that'll clear it up.
Sorry, thank you for
That's that.
doing all that. I always feel awful.
That's all right. Let's go to the blood test. So the kidney function is entirely normal.
Wonderful.
The liver function is pretty much normal. So your ALT, which is one of your liver enzymes, is slightly raised, but actually less raised than it has been.
Yeah.
And then you thought you might have a urine infection?
I thought I might do. I dipped it at home because I've got the dipsticks, and it came up with negative anything at the time, just because I've had urosepsis a lot.
Yes.
Just overly cautious, and yeah, I've had to self-catheterise a few times on and off.
If you had nothing in the dip and your bloods have been all right, you probably haven't got an infection. Natalie has a history of regular urine infections, which are a common complication when people self-catheterise, and sometimes those infections can be quite serious and not only in the bladder, and can cause her to have bacteria in her blood, which is a much more serious condition. There's quite a lot of evidence that quite a lot of people with symptoms that suggest a urine infection will get better without any treatment, and quite a lot of urine infections are inflammation rather than infection.
I'm constantly inflamed everywhere at the moment, so I did wonder if it could just be
part of that. Yeah, okay.
Is there anything that I can do to help when I'm having the allergic reactions? I'm taking IM Piriton, cetirizine down my tube, prednisolone. I've got steroid creams, but I just can't stop scratching.
You're on quite a lot for
of
it
things, yeah.
already, so I'm not sure that I've got any miraculous ideas. Sorry.
Smothering myself in
And I
Dermacol
see
every
that
night.
She stops you from scratching.
She does, yeah.
The reason why you want to scratch is because histamine's been released. Yeah. But when you scratch, you release more histamine.
Yeah.
So trying to not do it, but it's kind of easier said than done, isn't it?
Yeah.
Okay.
Yeah.
All right.
Thank you very much. Thank you so much for your help.
That's all right.
Put that in your bag. I feel like I need to breathe in.
Okay.
Thank you very
Nice
much.
to meet you.
Nice to
Bye.
meet you too. Thank you.
We should see you every year while you're on these tablets, because we've got to keep an eye on blood pressure and height and weight. It may be worth you just booking in for a routine blood test. Just want to check a few things out with regards to the tablet, and also because you mentioned feeling giddy 3 times a week. And does that have any effect on you? How long does it last when that happens?
It's usually about a minute to about a minute and a half.
And what's happening? Is the room spinning?
I just can't see nothing and I just wobbles.
Okay. Do you get a headache with that?
Yeah.
Okay. Is there any migraines in your family?
No, but I have had migraines in the past before
Yeah.
my seizure.
Okay. So we'll keep an eye on that and get your blood tests done. If that gets any worse or changes, to let me know.
All right, yeah.
Okay.
All right.
All right, Craig.
Thank you.
Take care.
Bye.
Brian Tunnicliffe. Come and have a seat.
Thanks.
Okay, so are we talking about your ear today?
Yeah, my left ear, I've either got an ear infection or a burst eardrum. I normally suffer with them quite a lot because my hearing obviously ain't too good.
Okay. What symptoms have you noticed?
Well, gunk coming out my ear, and plus I've got a bit of a cold, so painful in my ears.
It's been painful as well, has it?
Yeah.
Yeah. Is it painful now that there's stuff coming out of it, or was it painful
Not as
before?
much.
Not as much, OK. So was it painful and then started to discharge?
Yeah.
Yeah, OK, fine. And so have you burst an eardrum before from the sound of it?
Yeah, I've had 3 burst eardrums in 2 weeks before.
Right,
So,
OK, gosh,
yeah.
so it's happened many times.
Yeah.
Yeah, I can see, I've just had a quick look at your notes before you came in. I was seeing that you've got hearing aids and so
Yeah.
forth. And is your hearing not so good at the moment as well?
Not so good at the minute
Yeah.
because obviously, yeah. Plus I've just come back from Benidorm, which the heat might have something to do with it as well.
Were you swimming?
Yeah, quite a lot.
OK, OK. So let's have a look. Just get myself there.
I'm gonna have to take out my hearing aid now, but yeah.
So once you've taken it out, can you hear me?
Yeah, because I'm still can hear my right ear. I'm just deafer in my left ear.
Fine.
But you might need to speak up just a tiny notch.
I will.
Thanks.
Let's just. Oh, I can see the muck without even putting my thing in your ear here. But I will have a little look, but I'm sure you have, you know what's happened.
Yeah.
Okay, I can't actually spot where it's coming from, and there's not a lot of stuff in the canal, which is good. But I will give you antibiotics. That's what you need now.
Thank you.
Okay. I don't think they'll give you your medication unless you've got someone over.
No, my mum will probably go and collect it. So yeah.
Okay, so that's the week's worth of amoxicillin, same as last time. So it's 10 mils 3 times a day.
Okay.
All
Thank
right.
you. Thanks for your help.
Okay, pleasure. Bye-bye.
Bye-bye.
Bye.
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 Thank you.
Okay then.
Thank you very much. Yes, you'll be better off driving.
Okay, bye-bye, boys.
Say bye.